Assalamu alaikum warahmatullah. In this slide, you will see three pictures. This is Koshai Daktar, percentage Daktar. এখানে false certificate issue করতেছে. Doctor is issuing false certificate. Here, the doctor is giving addiction drug. These three pictures, what it indicates? কোনো ডাক্তার এই নামগুলো শুনতে গেছে তৈরি আছে? নিচে আমরা না এটা বলবো known on type of malpractice. Assalamu alaikum. I am Professor Shah, Professor of Forensic Medicine, Ibrahim Medical College. Going to present medical malpractice. Medical malpractice এর মধ্যে দুটো আছে. One is ethical malpractice, another is professional negligence, but professional malpractice. Today we'll discuss about the ethical malpractice. Objective of our session will be, at the end of session, will be able to define misconduct. Enlist the conduct or act which cause infamous conduct will be recognized as infamous conduct. Procedure of punishment for infamous conduct. This portion, that is medical malpractice or professional malpractice or professional negligence, we'll discuss later on. Hence, two types of malpractice. One is ethical malpractice, also known as professional infamous conduct. Ethical malpractice, also known as professional infamous conduct. Another medical malpractice. Other name of medical malpractice is professional negligence or malpraxis. These medical malpractice are two types. One is civil malpractice or civil malpraxis, another is criminal malpraxis. Our discussion will be limited to the ethical malpractice. In the next class, we'll discuss about this professional negligence, either civil and criminal. Today we'll discuss professional infamous conduct or infamous conduct or ethical malpractice. In ethical malpractice, we'll first discuss the definition of ethical malpractice, then examples or act or conduct regarded infamous conduct, and punishment and procedure of punishment of infamous conduct. Definition of infamous conduct. It is something done that is act by a medical practitioner in pursuit of his profession. Remember the term, this act is done in pursuit of his profession. With regard to his, it would be reasonably regarded as dishonorable or disgraceful by his professional brethren of good repute and competency. Another definition is same. Here is this portion is replaced by the conduct. It is a conduct on the part of a medical practitioner. This is the act done by a medical practitioner during the practice of his profession, which would be reasonably regarded as disgraceful and or dishonorable by his professional brethren of good repute and competency. Such a conduct or such an act that will be regarded as dishonorable or disgraceful by his professional brethren. In short, you will define infamous conduct as it is a conduct or act done by a medical practitioner in pursuit of his profession. With regard to his, it would be reasonably regarded as dishonorable or disgraceful by his professional brethren of good repute and competence. In this regard, three things. One is the conduct or act, another is in the pursuit of the profession of the medical practitioner. This conduct or act of a medical practitioner when in pursuit of his profession, that will be regarded as reasonably dishonorable and or disgraceful to the professional brethren of good repute and competence. This is in short about the definition of infamous conduct. The act or conduct which will be considered as a professional misconduct and leading to disciplinary issues. Here, here in this slide, there are top 10 aspects of the professional misconduct. This is defined in the code of the medical ethics of BMDC. This will be considered as a misconduct or malpractice, ethical malpractice, as well as professional malpractice. That will be considered for the disciplinary issues. Abuse of privileges. Abuse of privileges as a doctor. That is right and privilege of doctor. If anyone abuse this, his right and privilege as a doctor. Dereliction of professional duty. And abuse of privilege and dereliction of professional duty. Discreditable personal behavior. Improper personal relationship with patient. Untrue or misleading certificate and similar documents. Disparagement of other medical practitioner. Practice in association with non-qualified person. Covering or improper delegation of medical duties to non-qualified person. Performing criminal, conducting criminal suffering from criminal conviction. Misuse of professional skill. Adverse disciplinary findings by other professional bodies. If someone of Bangladeshi convicted by other professional bodies abroad or adverse disciplinary findings if against him, he will be also he will also have to face the disciplinary issues in Bangladesh. Now, some detail of these 10 topics. Abuse of privilege and dereliction of professional duty. That is serious disregard or neglect of professional duties. Here, abuse of privilege offered to a doctor. That is right and privilege of doctor if he abuse it. Or grave dereliction of professional duty. Or serious professional misconduct. Secondly, failure in maintaining a standard of medical care. Physician must be compassionate, competent, along with the readiness and attention in examination, assessment, and management of patient, appropriate and prompt action in emergency, requiring urgent medical intervention, and consultation if needed. That is failure in maintaining a standard of medical care. Lastly, abuse of privilege conferred by custom. That is doctor-patient relation, breach of trust in doctor-patient relationship. As because trust is essential element in maintaining doctor-patient relationship. If any action of the doctor which breaches this trust may raise the question of serious professional misconduct. Doctor must exercise great care and discretion in order not to breach the trust with patient. And this breach of trust may occur in these three situations: improperly disclosing information of patient, that is, disclosing professional secrecy, not maintaining professional secrecy. Secondly, influence upon a patient to gain financial or other advantage. Other advantage, send the patient to a laboratory and from there percentage is taken, that is dichotomy. And also some other financial benefit. Enter into the romantic or sexual relationship with patient or with other family members of the patient, like adultery or improper association with patient or member of the patient's family. Here, number one was the abuse of privilege and dereliction of professional duty. Second was professional behavior, personal behavior. This personal behavior, conduct that is behavior derogatory to the reputation of profession, conviction for drunkenness, or other offense arising from misuse of alcohol or other addictive substances. If the doctor is convicted due to the drunkenness or due to the addiction of other substances, this is the personal behavior. This also hampered the reputation of the profession. Perform professional duties under the influence of drink or drugs. Under the influence of alcohol, if he performed the professional duties like examination or conduct of delivery or other things. Indecency and violence. Exhibiting inappropriate behavior, action, or violence to patient or patient's relative. This is also infamous conduct. Adequate facility in private medical service. Though this is the responsibility of the private organization, but in providing private medical service, doctor should satisfy himself that those organizations provide adequate clinical and other support, other facility offered for the service. In addition to his personal responsibility to the patient, doctor has to ensure that where he is giving personal private service, that organization should have the adequate clinical and other facility for patient management or other things. And it is also the responsibility of in addition to his personal responsibility to the patient, is the personal behavior. Thirdly, improper personal relationship with the patient. Any form of sexual advance using professional position to pursue personal relationship of a sexual, romantic, emotional nature with the patient. That is adultery, under and or improper association with the female patient or female member of the patient. Previously, we learned in this fashion. But here, it is not only the female patient. It is said that any form of sexual advance using professional position to pursue a personal relationship with of a sexual, romantic, or emotional nature with patient's spouse, or someone close to them. Taking advantage of emotional dependency of the patient will be regarded as abuse of responsibility and trust, as because usually in the doctor-patient relationship, patient has the emotional dependency on the doctor. And by this, exploiting this emotional dependency of the patient, if the doctor gain abuse that aspect, that will be subject for disciplinary issues. This is another important issue, that misleading or untrue certificate and similar documents. Doctors sometimes produce certificate or reports, and this should be true, not misleading. Doctor expected to exercise care in issuing certificate and preparing similar documents should not include any statement that have not verified by appropriate steps, like insurance claim forms, payment receipts, medical reports, vaccination certificate, sick leave certificate, fitness certificate, etc. Sick certificate can be issued only after proper medical consultation of the patient. Here, the date of the consultation, date of the issue must truly be stated in certificate, not false certificate. Doctor should not issue untrue, misleading, or otherwise improper certificate or similar document. Signing of a blank certificate is prohibited by the council. Disparagement of the other medical practitioner. Whenever doctors are called upon to express a view about a colleague's professional practice, honest comment is entirely acceptable. Suppose as in the medical audit, peer review, giving reference about a colleague, or patient seeks second opinion, specialized advice, alternative form of treatment, etc. And lot of other situation, doctor may call to comment his colleague, another colleague, and it is carefully considered, can be justified, offer in good faith, intended to promote the best interest of the patient, not misleading or to them to criticize the other, etc. It is unethical for a doctor to make unjustifiable comments, which, whether directly or by implication, undermines the trust in the professional competence or integrity of the another doctor. So this is also an issue for the disciplinary action. Number 6, practice in association with a non-qualified person. A doctor should not associate himself with a non-qualified person providing any form of treatment for his patient. A person registered is regarded as non-qualified person. Even a qualified person abroad, if he is not registered in from the BMDC, he will be treated as non-qualified person. This will not cover the training of the medical student and medical technologists and nurse, as because they are under your supervision. Covering or improper delegation of medical duties to non-qualified person. Covering is very much important. Sometimes short note in the written examination, you have to elaborate it in short note, or in the oral examination, you have to face this. Covering or improper delegation of medical duties to non-qualified person. A doctor improperly delegates his duty to non-registered medical practitioner who assists such a person to treat patient. A doctor can only employ, otherwise engage a person to carry out the functions of the profession, medical technologist, nurse, physiotherapy, etc., if they are registered. Suppose whenever injury suture is given by a person who is not registered, he has no right to do this, or any operation he has no right. And whenever legal action filed against him, you suppose say this is under my supervision, or I have done this. This is known as covering. You are providing legal coverage. That is why it is also you have also have to go to the disciplinary issues. It is a misconduct for a doctor for his countenance or assistance by issuing certificate, notification, report, or other similar documents to enable a person who is not a registered midwife to attend women in childbirth or other under the direction or supervision of the registered medical practitioner. Criminal conviction. A doctor convicted of any offense punishable with imprisonment is liable for disciplinary proceeding of the council, even if offense not involve the professional misconduct. A doctor perform offense involving dishonesty, indecent behavior, or violence, prescribing or dispensing drug or appliance for improper motives. This is also a criminal conviction. Misuse of professional skills, prescribing or supply drugs of dependence, adverse disciplinary findings by other professional regulatory bodies outside the Bangladesh may likewise invoke the council disciplinary procedure. These are the 10 courts situation where the will considered for disciplinary issues. This is also professional misconduct or infamous conduct, whatever you says. If you go to the website of BMDC, you download the code, ethics, etiquette for doctors, and in that you will find this. Here there is a 10 point here. These are the professional misconduct or for disciplinary issues. Serious professional misconduct for disciplinary issues. In short, for your remembrance, the essential of forensic medicine and toxicology here by K.S. Narayan Reddy. From that, you also summarize this. Here, the 6A, that is adultery, abortion, alcohol, addiction, association of mere continuous practice, advertisement, avoiding consultation, attending a patient who is under the care of another practitioner. Adultery and or improper association with the female patient or female member of the patient. These also included all these 10 points. But for your convenience, you can, in this way, in this fashion, you can remember it. Then performing criminal abortion. Alcohol. Though a doctor can drink alcohol in the Western country, drinking alcohol is not unethical or illegal. In Bangladesh, drinking alcohol is not legal. It is only legal for the non-Muslim, and it is legal within the house, not the street. If the doctor use alcohol and thereby any source of practicing profession, that will be regarded as infamous conduct. Addiction of drugs. Association for mere countenance of practice for the non-qualified person. Advertisement, how you can advertise, how many times, it is clearly described in the BMDC guideline. Avoiding consultation for religious or other ground, political ground. Attending a patient who is under the care of another practitioner. You can remember by 6A, 3C, D, F, etc. this way. Here, in this picture, you see that this doctor is drinking alcohol, attending patient while on alcohol. This female is told that, doctor, my child is having high fever. Will you please come and treat? If at this stage, if the doctor attend her, it will be infamous conduct. This is another picture. Doctor is seducing a female patient. What doctor say? Miss, now will you please lift your t-shirt? I have to examine you thoroughly. But patient replied that, but doctor, it is my left knee. It is my left knee. I heard while playing. In this picture, doctor seducing a female patient. That is adultery and or improper association with the female patient or female member of the patient. One is covering. Already I told you, contravention of the drug law, conviction of the offenses for moral turpitude, commercialization of a sacred remedy, commercialization of sacred remedy, and D and F, dichotomy, is very much important for examination. Covering, dichotomy, advertisement, etc. Adultery is very much important. You have to know, you have to define it. You have to define it. It is very much important for examination. Dichotomy is a fee splitting. It is unethical. But fee sharing is not unethical or illegal. Disregard of personal responsibility to patient. issuing false certificate. It is not only infamous conduct, but also it is a criminal offense. Running open shop, from where you bound the patient to purchase the medicine, refusing to give professional service on religious ground, talking disparately about other colleagues, prescribing in a sacred formula. This is in short about some conduct or act which constitute infamous conduct. I have told you, I summarize this. I have told you the BMDC guideline of serious professional misconduct. Also, detail of the infamous conduct. Now, this is another picture. Percentage doctor. If the doctor is named by this, I already told you, if we ethical malpractice, that is, if you break the ethics, public will call you in this name, percentage doctor, Koshai doctor, etc. In this picture, the doctor is issuing false certificate. And here, most welcome to my clinic for pethidine, contravention of the drug law, that is selling, supplying drugs of addiction. This is a misuse of professional right. But you know my charge is high. Now, who will give punishment for infamous conduct? It is the BMDC, Bangladesh Medical and Dental Council, who can give punishment for infamous conduct. How? Let us see how BMDC will take action. At first, anyone may complain to the BMDC, either the victim or his relative or any other person. They can inform BMDC that such and such person is doing this type of conduct. He has the type of conduct. He has doing this type of act, etc. That is not regarded as good. That is not represent the reputation of his profession. After seeing this, after receiving this complaint, BMDC referred this to the disciplinary committee, and this disciplinary committee, they send a notice to the complainant and also the accused doctor, and fix a date. They inquiry it. Here, both of them, both the party, and if they find it any fact here, and according to its gravity, they suggest a punishment, and ultimately BMDC will decide what type of punishment can be given to him, and in this way BMDC give punishment. What are the punishment that can be given by the BMDC? On his warning notice, সাবধান করে দেবে এটা, minimum শাস্তি এটা, another erasure of the name from the register. Erasure of the name from the register, either temporary or permanent. এই দুইটাই শাস্তি দিতে পারে BMDC. একটা হলো warning notice, another erasure of the name from the register. This erasure of the name from the register may be temporary or may be permanent. Permanent penal erasure of the name of the practitioner from the register is considered as a professional death sentence, as because the practitioner is not allowed to continue his profession as a registered medical practitioner of the country. That is why it is known as professional death sentence. It is considered permanent penal erasure of the name from the register is considered as the death sentence of the profession. That's why it is known as professional death sentence. This punishment can be given to you for infamous conduct by the BMDC. So we discuss about the malpractice. Malpractice are of two types. One is ethical malpractice, also known as infamous conduct. Another is professional malpractice or professional negligence. Professional negligence are of two types. One is civil malpractice, another is criminal malpractice. In the next session, we will discuss this professional negligence. We discuss about the terms which constitute the professional misconduct. We discuss about the definition of the infamous conduct. We discuss the professional misconduct that are the point for disciplinary issues. We discuss the act or conduct which constitute the infamous conduct, and we discuss detail of those. You can go through the website of BMDC, from where you can download the code, ethics and etiquette, and from where you can find this. And also you can go through the book for examination. Both are almost all same. All the topics are included in this. Thank you very much. In this, we are ending here. Thank you very much. Assalamu alaikum warahmatullah.